The Kenya Covid-19 Fund Board, the Kenya Association of Manufacturers and Equity Group Foundation have partnered to procure and provide locally manufactured personal protective equipment, PPEs.
Today I want to talk about the health pillar, which is led by Dr. James Mwangi. Over the last 2 months, we've been working on his pillar. And the first thing he did was to be generous from his own pocket, him and his family, and they gave us 300 million shillings. It was followed by matching from Equity Foundation with another 300 million, and then followed by MasterCard Foundation. And together we have 1.1 billion shillings that can be spent on PPE. From the work I've seen the last 2 months, that PPE can be enough for usage in Kenya for the next 18 months.
More than 95 local manufacturers were trained on quality development of PPEs before a number were awarded tenders to begin manufacturing.
As the Equity Group Foundation and the Kenya COVID Fund and Kenya Association of Manufacturers, we have worked on capacity building of local manufacturers with a number of our partners who include McKinsey, IFC, GEBA, and others to ensure that we build the local capacity. One of the commitments from the fund was to support the Buy Kenya, Build Kenya agenda and also ensure that we give quality products to our frontline healthcare workers.
When production commenced, the COVID-19 Fund Board toured manufacturing facilities in Nairobi, Kikuyu, Kitui, and Athi River to assess the capacity and quality of PPEs produced. Among the manufacturers visited by the board was Manchester Outfitters in Nairobi's industrial area that has the capacity to produce 2,000 coveralls in a day.
I'm happy to report that from the fabric, it's made locally, and the outfits you're showing are made locally, and they are up to standard. We've worked with doctors, a group of doctors, a committee for the COVID fund, and they've confirmed they like this stuff. But also we're going to continuously improve because we have to start somewhere. And so long as doctors are happy, we have to protect them. They are frontline partners in this process of dealing with COVID, and they are happy. So I can confirm they like the standard.
In Kiambu County, the board visited Texplast in Kikuyu and Alphanit's factories in Ruiru that have dedicated a significant proportion of their machinery to produce PPEs.
We have decided that we would like to make sure that we procure maximum of our items locally to promote the local industry and make sure that the job is being sustained in this time. So we kill two birds with one stone. Main reason for us why we have decided to continue working with the fund is to ensure the quality of what we are giving to our doctors meets the standards, because it's very important for us for the doctor to be fully protected, because that is a critical thing. As you see the numbers going up, it means that we must protect our medical guys, because if those are affected, then it will be a crisis for us.
In Kitui, the board visited Kiko Tech, where more than 700 young people from the local community are employed to make different sizes of PPEs to be distributed to hospitals free of charge.
We use ultra-modern machines, and we continue to improve on the qualities and the training. Right now, we have about 700 of these young people. And what we did was to self-quarantine ourselves, because we realized that with so many people working in Picotech, if they were all to go and stay outside, it was going to be a challenge, because they certainly, if we got one person who would be infected, then this high number of people can also be infected. Kenya Association of Manufacturers Equity Group Foundation, we thank you so much, COVID-19 team that has come to support the work that we are doing here in Kitui County Textile Center.
The chair of the Health Committee of the COVID-19 Fund Board, Dr. James Mwangi, led a team of health professionals to the Shona factory situated in the EPZ in Athi River, where the production was in full gear. The team witnessed the stitching, cutting, and quality control carried out using state-of-the-art equipment at the factory that has a capacity to produce 12,000 coveralls every day.
What has been the most amazing is the collaboration by the manufacturers. There is a manufacturer who is now producing the raw material. This raw material is not imported, it's produced in Kenya. And then he produces for the other factories, and the other factories specialize who produces what. Here we are specializing in 2 items. Then another factory specializes on another 2 items. And so we distribute the jobs within various parts of the country so that as many Kenyans could really benefit.
The company that employs 600 staff is set to increase capacity further to employ more people to produce even more PPEs to meet demand in Kenya and for export.
We want to always make sure that the quality of what gets out of the facility is top-notch. So what we've been doing is ensuring that we work on quality from the time we get our raw material. We have our quality check on raw material. We will have our quality check when the fabric is cut, when it's in production, and in the end line.
Dr. Mwangi, who is also Managing Director and CEO of Equity Group Holdings and Executive Chairman of Equity Group Foundation, said creating a strong local manufacturing capacity in the country guarantees a steady supply of PPEs.
We had made a commitment that the 1.1 billion shillings that Equity Foundation had managed to assemble would last the country for 6 months. We are confident we'll be able to support our public hospitals and our staff in government institutions dealing with COVID for the next 18 months. We have been able to stretch a shilling 3 times simply because of ability to re-engineer the process. And we are working very hard with Phyllis to ensure we make a breakthrough for the Kenyan factories to start delivering to the regional market.
Phyllis Wakiaga, who chairs the procurement committee of the COVID-19 Fund Board, said Kenya is developing into a regional manufacturing hub for medical-grade PPEs that meet international standards at affordable prices.
When we started this journey, we sat together with the fund and Equity Group Foundation and said that we're going to be very deliberate about supporting local entrepreneurs and local manufacturers to ensure that we get the right quality within the country and we have the supply of the PPEs we require. Local capacity exists to do a lot of the things that we import into the country.
Ear, nose and throat ENT specialist Professor Isaac Masharia, who is Equity Kenya chairman and also chairs the COVID-19 Board Health Technical Committee, confirmed that the PPEs manufactured in Kenya meet international standards.
The industry has been very, very responsive to the feedback from the health professionals. This is the first time that health professionals have been involved in affirming the standards that they would want to have in the equipment that they use in their job. As we start using these PPEs, we will get feedback on the practical use of this material, and we shall bring this feedback to the manufacturers. And if they continue in the trade they have been, we shall be able to improve them even better, that we'll be able to get higher quality of PPEs than what we buy from outside.
At Fago Courier in Nairobi, the board was at hand to witness the loading for dispatch of the first consignment of the locally manufactured PPEs worth 223 million shillings.
Equity as a group has been our partners for over 20 years in business. It's been a very long-standing partnership, both in terms of security, contract logistics, as well as courier. And with the support of partners like Equity, it has enabled Fargo to become the largest domestic supply chain partner in Kenya.
As hospitals begin receiving the PPEs, Kenya Medical Association, Kenya Clinical Officers Association, National Nurses Association of Kenya, Kenya Society of Anesthesiologists, and Kenya Medical Practitioners, Pharmacists and Dentists Union are sensitizing the frontline staff on efficient use of the equipment.
At tri-age, have your mask. At level 2, have your gown, your mask, with face shield or goggles. And at level 3, have your head cover, your face shield, your goggles, your N95 mask, a surgical gown, and a coverall.
In assessing the PPE for each item, there's a specific checklist that has even measurements to to include the sizes from small, medium, large and XL. So make sure you fit your size, one that you're comfortable to work in.
This is the disposable scrub set. The disposable scrub set comes in a very nice blue color. It is made of a top and a bottom. So the top comes with 3 pockets where you're able to put in your pen up here, and down here you're able to put in other materials. It's supposed to be free to fit most of your stuff.
Working in partnership with the Ministry of Health, the COVID-19 Fund Board is achieving the objective of protecting medical personnel while creating a local medical supply ecosystem that is mitigating disruption of the global supply chain and, most importantly, keeping Kenyans safe.